Three paramedics who transported Thomas Duncan to the Dallas hospital are temporarily off duty, and among those, they are under observation as well. Paramedics are likely the first medical professional someone would see, so what can they do to stay safe and prevent the disease from spreading? KXAN's Aaron Cargile takes a closer look at the extra steps local EMTs are taking.
Up to this point, a lot of the focus has been on how prepared hospitals are. At 5 o'clock, we took you inside UMC Brackenridge and showed you what an isolation room looks like. But the reality is paramedics could be the ones who first come in contact with an Ebola patient. Austin Travis County EMS says as soon as the news broke in Dallas on Tuesday, they sent information to their crews reminding them about the signs and symptoms of Ebola. Back in April, paramedics started asking patients questions about travel if their symptoms were flu-like. We are also told paramedics are already doing enough to protect themselves on a regular basis, always wearing masks and gloves.
We don't want anybody to take offense that we're protecting ourselves. We're also protecting our patients by prevention of spread of disease.
And there is also a procedure in place to disinfect every inch of this ambulance on the inside if they do transport a patient who is showing signs and symptoms of Ebola. And they actually use a machine to do the work. In downtown Austin, Aaron Cargile, KXAN News.
We want to show you a timeline of how Thomas Duncan was diagnosed. Duncan left Liberia back on September 19th, 12 days ago. He arrived in Dallas the next day. On September 24th, Duncan started developing symptoms. That's when he became infectious. 2 days later, Duncan walked into an emergency room at Texas Health Presbyterian Hospital in Dallas. He left hours later because the doctor there did not know he had recently traveled to Liberia. Then on September 28th, Duncan returned to that same hospital where it was determined he likely had Ebola. With this case, hospitals here in Central Texas have already changed some of their policies. Seton Medical will now ask every patient if they traveled outside the United States. Remember, that was a reason why Duncan was released from the hospital last Friday. St. David's Medical telling us they are learning similar lessons.
It demonstrates how important it is to ask those questions and to identify those patients when they do enter your facility.
The CDC has specific guidelines for hospitals to catch possible Ebola patients, namely a fever higher than 101.5 degrees.